stats. The NHS are seeing increasing numbers of young men requiring treatment after becoming addicted to trading Bitcoin. Patients are becoming hooked on trying to make money from volatile cryptocurrency markets. And joining me now to discuss this is recovered gambling addict and the author of Tales I Lose, Justin Larkham. Justin, welcome to the show. This perhaps will come as no surprise to you, but I'm particularly interested in why is it that young men in particular seem to be going down the route of video game addiction, porn addiction, gambling on football addiction, and now the latest one, cryptocurrency trading addiction?
I think generally that socioeconomic group are probably thrill seekers. They're people who enjoy risk and reward. And unfortunately now at a very early age, people learn that in those video games that you mentioned. And then it develops into something else. And cryptocurrency, as you say, is very volatile. It's the thrill.
And also what you get, Justin, I see this a lot. I mean, you know, full disclosure, I have a little dabble for a bit of fun on gambling websites, on a bit of football. I'll be on the Euros. I do a little bit of crypto, but I do it as a bit of fun. And it says here that half of people treat it as such. But when does it become a problem? Because I see the adverts all the time luring young men in with the offer of massive fortunes for little output. If it's too good to be true, it often is.
Absolutely. Unfortunately, the bookies always win in the end. And that's the problem, really. I guess I'm not anti-gambling. For myself, I would never be able to gamble again. And there's a small percentage of people that go on to have an addiction to gambling, which is horrible. It is really crippling. It's one of the worst addictions I could ever imagine. It destroys relationships. It, unfortunately, in the end, will take people's lives. And an addiction in general is something that we are, for a certain proportion of people, will have a presupposition to gamble. And it's Bitcoin is another example of that.
And Justin, quickly, Amanda Pritchard, who's the chief executive of NHS England, said we need to take action against these cryptocurrency trading sites because it's the NHS that's picking up the bill. Do you think it's fair that the NHS should be treating gambling addicts? After all, it's a lifestyle choice.
Yeah, and you know what? For a long time, they weren't. It was picked up by a voluntary levy on the industry. It's now become a compulsory levy, and that offsets some of the money that the NHS have to fork out for this. It is a lifestyle choice to start with, but let's be really, really clear. It stops being a lifestyle choice when you go down that slippery slope. And for some people, they will. So there do need to be warning signs around it. I just think there needs to be a little bit more control on this, as there are in other places.
Superb stuff. Thank you for being so forthright. Justin Larkham is the author of Tales I Lose. Thank you very much for your honesty. Much appreciated.